I'm Sarah Flanagan. I'm the physician assistant and lead of prenatal care program at Sanctuary Refugee Health Center. I've been here for about 4.5 years, and I came to the clinic because I had an interest in refugee and newcomer health and a background in medical anthropology. So this position allowed me to combine both of my interests in the clinical setting, and it's been wonderful. I chose to get the vaccination for myself, primarily because I see only pregnant patients and newborns throughout my clinical day. And so we know that patients in pregnancy are more prone to complications from COVID-19. And so I wanted to be able to protect the patients that I'm seeing day to day. Also, for me personally, I'm currently 9 months pregnant and was at the time that I received my first dose of the vaccination. And so for the last 9 months, every day has been bring your baby to work day for me. And so it was really important as I continue to see patients until my baby is born to have that extra protection for myself and for her as well, and to bring that extra protection home for my family. So it was important for me to protect my patients and their babies and their families, but also really important to me to protect my baby and my family while I see my patients as well. So the most common questions my patients ask, other than when can I get the vaccine, which is up and coming soon, hopefully for everybody, is it safe to receive in pregnancy and with breastfeeding? And so my response has been that while there is no data because pregnant and breastfeeding women weren't included in the initial studies, the way that the vaccinations, particularly the mRNA vaccinations, have been developed, there's no increased theoretical risk to baby or mom in pregnancy or with breastfeeding. In fact, there could be some added benefits of passing antibodies, especially through the placenta or through breast milk to baby as well. So giving them some protection from COVID-19 also. And we discuss with our patients that it's a very personal decision, but we do know that the risks of contracting COVID-19 in pregnancy and in infancy in the newborn period are not theoretical. We now have some data showing that it is much more serious and there can be much more severe complications, especially in the third trimester with pregnancy. And so if patients of ours are falling into high-risk categories because of their employment, because of their social circumstances, or any of their medical history in addition to the pregnancy, then it's a conversation that we're having to determine whether they are comfortable receiving the vaccine and the risks outweigh the benefits. And so I've been very encouraging for a lot of our higher risk patient population that this vaccination, when it is available to them, is a good choice as well. In terms of fertility, we also get lots of questions right now about the potential long-term impacts on fertility, and my answer is largely the same. A lot of the concerns about long-term impacts on fertility came from the fact that the initial recommendations were not to include pregnant and breastfeeding women in the vaccination cohort and in the studies that were done initially. So again, there's no theoretical risk from the way that the vaccines were developed that could impact future fertility. We now know that some of the women who were in the trial were able to conceive afterwards, unrelated to the trial. So we have cases of that now where people who have received the vaccine have gone on to conceive. And so there are no theoretical increased risks at this point. So again, if patients are falling into a high-risk category where we would otherwise recommend the vaccination, I would still encourage the vaccination to be received. As I've mentioned, I am recommending for all of my moms and moms of newborns who are breastfeeding that if they fall into the high risk category, this is a conversation to be had with their healthcare provider, but that I'm absolutely recommending this to my patients when they fall into those high risk categories and when they qualify for the vaccination themselves. So protect yourself, protect others, get vaccinated.